Hi, I'm Martin Felsen. Welcome to CityDesign, where we explore how we shape cities and how cities shape us. Today, I'm asking a spatial question. Is it better to help people experiencing homelessness with one big campus or with a network of smaller support services spread across the city? Campuses aggregate services in one place, fast triage with tight coordination. Community networks distribute help across neighborhoods closer to jobs, transit, schools, and daily life. In this episode, I'll explore both models as they try to meet people's needs from crisis to stability. I'll score both models across 9 factors from struggling to surviving to thriving. Before we start scoring, here's a quick snapshot of the two models and how we'll compare them. Our primary campus model example is Haven for Hope, a 22-acre site in San Antonio with about 300 staff. This campus is one large, well-managed site with co-located providers, centralized intake, emergency care, clinics, treatment centers, shelters, and transitional housing, all under one roof with clear wayfinding and consistent service. Our primary network model example is Chicago's citywide system of shelters and services. This network of resources has many small doors spread across the city: shelters, clinics, nonprofits, outreach teams. They're not physically connected. Instead, they rely on referrals, often sending people crisscrossing the city seeking specific services. To compare them, I'll use a simple 0 to 5 scorecard. Higher is better. First, mental health. How fast can someone in crisis get real help? At the Haven for Hope campus, services are co-located, so assessment, medical care, and follow-up happen in one place. Over 75 partner organizations provide comprehensive on-site medical health care. In Chicago, care is scattered across websites, hotlines, and offices. It's hard to navigate, especially during a crisis. Next, substance abuse. What support is there for detox and recovery? Haven for Hope offers safe detox space plus medication-assisted treatment on the same site as shelter and case management. People get recovery services, 3 meals a day, secure indoor sleeping, showers, and medical care all in one place. Substances aren't allowed on campus and belongings are checked for safety. In Chicago, harm reduction programs are available, but they're spread across multiple locations. That fragmentation makes it harder to stay engaged and easier to fall through the cracks. Next, physical health. Basic medical care plus a safe place to sleep. On the Haven for Hope campus, basic medical care is integrated with shelter, which can reduce ambulance and ER use. Showers, laundry, secure sleeping, no fixed time limits, and an on-site medical, dental, eye, and behavioral health services are all available. In Chicago, drop-in centers, community clinics, shelters, and hospitals are spread across the city. Services vary by site, and moving between them is time-consuming and expensive, so emergency rooms and ambulances become a default safety net. Next, legal rights and paperwork, IDs, benefits, and court orders. At Haven for Hope, ID replacement, veterans representatives, and court liaisons work side by side on campus. People can tackle legal issues and paperwork in one place instead of bouncing around the city. In network systems, you might go one place for IDs, another for legal aid, another for healthcare. Fragmented services and inconsistent case management raise the risk that people drop out before resolving their issues. Next, daily life and stability, the routines that help someone move beyond constant crisis. A campus can provide predictable routines. Haven for Hope's residential programs aim to address underlying causes of homelessness. The average person stays about 4 months as they transition and services are free. Yet, remaining in the community instead of a campus can preserve existing routines, jobs, and family ties. But this only works if people can find stable transitional housing. Next, kids in education. What happens to school when a family loses housing? Haven for Hope offers childcare, preschool, a playground, and an activity center. They coordinate with school districts so every school-age child stays enrolled. Buses pick kids up first and then drop them off last to protect privacy. But most kids want to stay close to their schools and friends. In a strong network, transitional programs help families stay tied to their own schools and neighborhoods while they stabilize. Next, socialization and community, where people find connection and belonging. On a campus, recreation and recovery activities can build community, but large facilities can feel institutional and temporary. In the network model, people can keep familiar ties to social groups and faith groups and peer networks in their own neighborhoods. Next, employment, reconnecting people with work and income. Haven for Hope offers on-site job coaching and placement services. In a citywide network, people are closer to businesses and transit. It's easier to get training, get interviews, and show up reliably for work. Finally, long-term housing, the real measure of success. Campuses can offer transitional housing for a few months, often far from where people ultimately want to live. Urban networks are better positioned to connect people to permanent housing in the communities they choose. Programs that focus on rapid placement into stable homes help prevent future instability and repeat shelter stays. Here's what the numbers look like. When people are struggling, the campus model has the edge. Once people are stabilized, the campus continues to offer wraparound resources while the network model keeps people connected to their communities. But to really thrive, people need housing alongside support. Affordable, long-term supportive housing is itself therapeutic. So let's end with a few examples. Let's start in Austin, where Community First Village feels like a small, supportive town. It's a 27-acre neighborhood with permanent homes and on-site support for people who are chronically homeless. The homes are modest but dignified, tiny houses, mobile homes, and even some innovative 3D printed homes. It's all tied together by porches, gardens, and shared spaces. In Los Angeles, Star Apartments is a 102-unit permanent supportive housing project for people who were formerly homeless in Skid Row. The design stacks prefabricated housing modules above a ground floor health and services podium. A large outdoor terrace acts like a rooftop public square with space for exercise, socializing, and events. A few miles away, the Six provides 52 permanent supportive units, many reserved for disabled veterans. Apartments wrap around a carved-out inner courtyard, balancing private homes with shared outdoor space. In San Francisco, the Dr. George W. Davis Senior Residence and Senior Center combines supportive housing with public space for low-income and formerly homeless seniors. There are 121 affordable units wrapped around a courtyard with a busy senior center at ground level. The center hosts programs for food, health, arts, and social life, so residents don't have to travel far for connection and care. From a policy perspective, the contemporary homelessness crisis took shape in the 70s. That's when we moved people out of mental health facilities much faster than we built community-based support. 50 years later, the evidence is consistent. The most effective way to help people get off the street is to offer a long-term home and pair it with support services. That's the core idea behind supportive housing. Whether we design a campus, a network, or ideally both, our goal is straightforward. Move people into stable homes in safe communities as quickly as we can. Thanks for watching City Design. If you're enjoying these episodes, please like, share, and subscribe. See you next time as we keep exploring how we shape cities and how cities shape us.